you're doing it. Hey, it's Dr. Jeff from Michigan Sports and Spine. This is week 6. So it's our Wednesday afternoon. Facebook, Instagram Live. And I really appreciate all the feedback we've been getting. I mean, it's really been a different way of connecting that has really proven out to be beneficial. I think the benefit's more for me, and I do appreciate you guys coming forward, saying things, and the growth of it is truly humbling, and I'm finding hard words to describe, but I do appreciate it. And last week I had someone tell me that, you know, I'm very sarcastic, so Jules always picks on me that, you know, I just need to be straight up and appreciative. So to just start off today, I am appreciative of everybody kind of giving us this feedback and giving me the energy to continue to do this on a weekly basis. And actually, we're having a lot of fun. It's breaking up the day with the telemedicine. It's breaking up the day with all the issues going on with COVID. A lot of questions are coming up right now. Most of the questions are, Doc, what do you think? Do you think the numbers are increasing? Are we going to be seeing a setback again? And I'm talking to a lot of my friends, even my cardiology friend today that, you know, he was calling me and saying, why aren't you calling anymore? Because he's the cardiologist I use for all my backstage stuff with all our entertainers and our rock stars that come in and with weird requests. And he's like, I haven't heard from you. I go, dude, I'm not backstage. There's nothing going on right now. And he's like, yeah. He goes, I really don't have any other reasons to talk to you then. So talking to him, his business is getting busier. He works both in the hospital and outside. So the message is that the numbers are going up, but the good news is right now is that the hospital numbers are not going up. I just talked to one of our patients that works in the Beaumont system, and there's 185 patients with COVID in the whole Beaumont system. And that's a big difference than when at the peak it was 12,500 or 1,200 patients then. And in some of the systems, there's no COVID at all. So we are seeing higher numbers of what's going on, but overall, we're seeing less hospitalizations. And it's true, like I had another patient talk to me today that he's being tested, he's running a fever, and everything, if it's a fever, is related to COVID. And it turned out it's just an upper respiratory infection, sinus infection, which has nothing to do with COVID. So we're all being overly cautious appropriately, but the thing is we need to be aware of it. You know, we are slacking off. We're slacking off in public, but I'll be honest with you, our offices and our surgery centers and everywhere we're working, we're not slacking off. We're holding tight to the restrictions, the CDC guidelines, and all that. So I just want to kind of start with that you know, times are different. There's a lot of stuff going on emotionally, and for you guys to take time out and to watch and give me feedback and questions, it tells me that we're hopefully making a little bit of a difference and hopefully making, you know, some positive impacts on you out there, and share with your friends and all that stuff is what I'm supposed to say. So we have a bunch of questions. In fact, we've had more questions than we can answer, but some of these I'm going to start with one from Ronnie. What are good stretches for low back and hamstrings without pulling and hurting my abdominal scar tissue? What about yoga stretches for this? So, to be honest, it is, you know, you have your abdomen. Again, that's part of your core. Okay, so it's very difficult not to engage your abdomen. And I do this a lot with patients, female patients that have C-sections, or anyone who's had like abdominal hernia repairs or hernias in the past. It is an issue, but it can be overcome. And what we do is the classic hamstring pull or stretch. You know, the simple stuff, throw your leg up on a table, you know, lean down and stretch, do the hamstrings that way. An easier one that's a little bit more controlled is when you lay on your back and you lift your leg up. You can bring your knee to your chest and then eventually extend your knee. So, you know, we'll try to have some exercises sent out, or I'm even going to, what we're going to start doing is bringing on other guests. And so maybe I'll bring in one of our trainers or therapists to address those issues, because I'm not going to start getting on Facebook Live and showing you my stretches. But if you can imagine, you're laying on your back, your legs coming straight up, and if this is your knee, you're bringing your knee and you're pulling it back like this, and you're eventually strengthening up your knee. And then when it gets straight, you want to dorsiflex, bring your toes down, and you're going to get a even better stretch. So that's a simple way to do it. You can lay on the ground, leg stretch, all that. So that's for your hamstrings, and the low back is the same thing. So when you're with your low back, there's ways to do it, even like grabbing the doorway. So if you're up there grabbing the doorway, you got to get a full body stretch. You just want to get everything back. To be honest, right now I'm stretching my back just by lifting my arms straight up and keeping my back with good posture. Is going to extend and create what I talked about last week, is that natural lordotic curve. So there's a lot of stretches. We'll make sure we send out this week in our email blast, and that we make sure that those stretches are in there, because we've done it a couple times already. But to be honest, to avoid the abdominal, and I appreciate that you sent that, because that is issues for a lot of people, is that you don't want to engage. So it's not one of those crunches type of thing. So it's a full body stretch. So you're accentuating your body or lengthening your body.
Thank you.
I got to thank you on there. So that's what we're going to focus in on. And it's not just your hamstrings and your back. You have to do your oblique muscles, your paraspinal muscles, so it's all connected. So usually I just tell people to slow it down. So as far as with the abdomen, we still need to work the abdominal muscles, because again, like I've been pushing big, there's the easy 4-pack, but to get the 8-pack, you really got to work on from the abdomen down to your pubic bone. And those are harder, and I've seen some crazy exercises to do that none of my patients can probably do to start with, but we're going to try to at least show that in a variation. And those are they're difficult to do for multiple reasons. One, because we're naturally weaker from the belly button down to the pubic bone, and it's harder to train. It's easier to train the upper muscles. So the more we can get you moving towards that direction, which there is a lot of yoga that you can do for that, and it's beneficial. So there's some yoga poses that you can do, but it is difficult, but it's not impossible. So again, just like I started with a bunch of people, your abdominal muscles, even if you had surgery, they're still there. There's still scar tissue there. There's still muscle to be formed. So you still have that attachment that can be strengthened overall. All right, so next question. How to manage back pain if my work requires me to stand for a long period of time? This comes from Safa. So that's the big deal. So a lot of times I have a lot of individuals that are working in a standing position for 8 hours. That doesn't mean you stand in one position. So if we go back to what gravity does, and gravity is really what we hold on Earth, and I don't need to get into the science of it, but it holds us upright. Well, there's forces that are pushing us down. So when we're standing, we're firing muscles all the time just to be in the position. If we're in a sitting position, if we're in a standing position, you're using your whole core muscles. So what happens if you're standing in the same position, you get a firing pattern. So the firing pattern of the muscle will actually, if you don't reset it, and we talk about that 15, 20 minute change your position, don't hold anything for 15 to 20 minutes, because if you get into the muscle spindles, the muscle is made up of multiple things. So let's just simplify it. There's something called muscle spindles that hold the muscle together. If you're engaging the muscle for a long period of time, those things will go into like what we call an overfiring or a spasm. So what you want to do is just you pull that muscle apart, you stretch it, you move, you change positions. You put your foot up on a little stool, you put your foot up on the desk for a minute. You raise your arms above your head. What you do is you change the whole dynamics of that muscle, what it's doing to hold you into that posture. If you don't move, it's just the brain keeps signaling, hold that posture, and eventually you're just going to overload that section of the body. So if you just reset it for even 5 seconds, 30 seconds, you're able to reset it, and now the muscle can kind of go back and reset and form. So you don't get into that overfiring, that spasm, that muscle tightness that we talk about. Or like the clenched teeth, I talk about with the neck is more important or more commonly seen. So you need to be able to change positions. So the simple answer is, when you're at work and you have to stand for long periods of time, you're not the military in front of the Buckingham Palace in London where you have to stand there rigid. You're able to move, you're able to be flexible, you're able to twist once in a while, you're able to rotate. I'm not telling you to lay on the ground for 20 minutes and stretch. I'm telling you to break form every 15 minutes, stretch, take a minute or something, and just move around. I always say to my patients, if you follow me around all day long, you'll see I never stay in one position. Like I remember when I was a resident, because I've had a back pain for years, I was disrespectful because my back, when you're working with an attending, you have to listen to him and you're on his time. So I had to stay in position and we were talking for long periods of time. My back was flaring up. I put my leg up on the bed, just the bed area, and just to stretch out, my attending almost wanted to kill me. What the hell, what was I doing? But the thing is you need to find a position and a way to stretch out. So if it's just a matter of doing a simple lunge, doing a rotation, you need to do that on a consistent basis. Because my classic comment for patients that have seen me, you can't work an 8 to 10 hour day, expect to stretch for 20 minutes at home and think you're going to resolve anything. You'll never catch up. And it's always about catching up, getting ahead of the game. That's why we push so much on prevention. So we're pushing for that in this case also. Hopefully that answers your question. If not, we'll expand on it a little bit, maybe on one of the next shows.
Victor says, looking good, JP.
Shout out to Vic. Okay, so next question. If I'm having slight knee pain, but it's happening more often now, when is it time for me to see a doctor? Anything I can do before I get in to see one? So really, this is a great question. So my rule is 2 weeks. It's always 2 weeks, okay? If you're having an issue and it's gotten worse, so if you have an initial injury and it becomes ungodly, uncomfortable, for 3 to 5 days you need to get in right away. If something's there and it's just not going away after 2 weeks, you need to see somebody. There's all these reports in CNN and magazines that, you can wait 2 to 3 months for low back pain. That's so old school. You need to be proactive. When you start waiting 2 to 3 months with an injury, you start setting in, what we call the arthritis and the injuries and bone spurs. That's what happens. When you get early prevention, even if it's simple, early prevention will always win out. So it's not like you need to run to the doctor, but you have to be aware of what is worse or better, okay? So if you're bad for 2 weeks, just bad, it doesn't improve or it gets gradually worse, you're in a physician in 2 weeks. And that's why we've based our appointments, like I'm not the doctor who says I have a 2 to 3 month waiting list. I'm deal with injuries, acute injuries, pain. You're in within 2 weeks, okay? Right now everything's a little goofy, so it may be taking a little bit longer, but if you express to our secretary you need to get in, it's a 2 week cycle. So as far as your knee, if you're having more frequent knee pain, that's an indicator, 1, you're sitting around too much, 2, your infrastructure, what we talked about, like again, a lot of people aren't working their 8 to 10 hour days where it's a natural conditioning. When you're sitting around and you have a bad knee or a knee with early, what we call arthritic changes, but usually it's something to the meniscus or other areas of the knee, of the structure, you're not going to get that power, the core muscles around it, which I've talked about a couple times now. There's a core structure around the knee. So if your quadriceps, your upper thigh starts getting weak, and now you're starting to move around, you're doing more activities, you create that weakness, like I said, over the 2 to 3 months you've been inactive, which normally from work and activity level, it would have been naturally strong enough to hold that knee together and hold that core to not put the pressure on the joint itself. Because if you take away that core strength of the knee, you're putting more stress on the joints and the ligaments, which is going to lead to early injuries or premature injuries or injuries that could be prevented, which is really what we were talking about before. So you want to increase your strength in your quadriceps, in the upper part of your leg. So to do that, it's usually done by what we call a closed chain kinetics. So the example of a closed chain kinetic is like the leg press, when you put the weights and your foot's flat on the weight and you're doing you're pressing it up, as opposed to lifting the weights with the weight here and you're lifting it up. That's an open chain kinetic, which is actually puts the knee at a disadvantage. The other thing that's just simple is do the old exercises where you lay down in bed or on the floor and you're lifting your feet 2 inches up. you keep your knees separated so your muscles actually have to work harder. So if you want to do that for 10 seconds 10 times, and then gradually build that up to longer, and then when we do like a wall squat, there's a lot of things you can do. You can, if you're a little bit older, you sit in a chair with arms on it and you do an assisted raise and squat from there. It's more of a protective way of strengthening your legs. So hopefully that answers that question. But to be honest, if it's been over 2 weeks, you probably need to come in, and we have really good remedies for knees. And we can start talking about PRP and stem cell and injections and all that. But again, I mean, you're really concerned about prevention, which I like that question. So going back to Diane's question, what is aromatherapy and is it better than acupuncture? So it's a great question, and it makes me giggle a little bit because I do giggle a lot. That's not true. But the issue is aromatherapy and acupuncture is categorized, if you look on our website, as alternative treatments. But they're very different. They're very, very different. Aromatherapy is exactly what it says. We work with Arlene Redmond, who's very knowledgeable. I actually have to stop talking when she starts because my education ends with lavender, and there's a lot more things going on than just lavender. I say that funny, but I know a little bit more than that. But I do endorse it. I endorse. It's funny because I watched another podcast, a medical podcast, about how we're being pushed and physicians are getting paid to do certain medications for prevention. And so they're treating the problem. They're treating the symptoms and the issues, the after effects. There's nobody really spending a lot of time, at least 5 years ago, now we're getting more, is what is causing it? When can we back up and say, look, is healthy eating, is nutrition, is it, heart disease? Where is it? Dr. Joel Kahn is living proof of what's going on from a cardiac standpoint. There's people that's on our virtual team that's all we're doing is we're looking at ways that we're going to prevent it. I'm not the guy to say, okay, your blood pressure is this, let's start you on medication. It's, I'm having back pain, let's start you on a narcotic. That's absolutely not what we're trying to do. We're going, and the last time I got ripped on, insulted on my Facebook was from a patient that just didn't get it. She was having GI issues, and I was just trying to think of alternative ways to do it. And her mental picture was that she wanted a pill to fix it. A pill to fix it is it's your last resort. And we're not talking about like cancers and severe heart disease and things like that. Medication is, I'm not saying medication is bad. Medication is definitely helpful in many, many ways. And we need to, look more for the alternative to begin with, or at least incorporate it. And Jules just walked in and she's making faces. So Shuling, come on, get in here. So Jules is here, and we're a great team. And the reason, to be honest, the reason I have Jules is because I never wanted to be the classic medical office. A lot of people was like, well, is she a medical assistant? I'm like, no. People don't even know that Jules is trained as an athletic trainer. So from day one, from the day I started practice, we wanted an alternative way of treating. I mean, I always make fun that our goal is to get you on the field by Sunday, right, Jules? Mm-hmm. So it's not like, oh, here's the pill that's going to get you on by Sunday. It's like, what alternative things, what exercise, what mode of treatment can we do that's not always medicated related? And it's the training, it's how you exercise, it's how you do the prevention. So Jules' mentality of, I need to get my player back is with the way we treat the office, and that's perfect timing. And what's your opinion on aromatherapy?
Aromatherapy?
Aromatherapy is the current question.
And you brought me into this?
Yeah.
Aromatherapy is fantastic. I use it every night.
Actually, she does. She does use it to help her sleep.
I do. Absolutely. At the office, we could probably get a diffuser in here for that.
We do have a diffuser in the Troy office.
Yeah, we need to use it.
So acupuncture, I mean, wait, any words of wisdom?
Go Tigers.
Go
Baseball.
Baseball, okay.
Sorry.
That was good input. So we're very lighthearted here. Catch us after 5. That's why we have to do this at 3:30. We're at least somewhat professional before 5. So to answer the question seriously, aromatherapy are aromas. Just like you said, there's lavenders, there's multiple things, and they've been proven for senses to desensitize or relieve or relieving of muscle spasms. It helps with gut. Mickey Redmond is a big component of, and a big user and advocate of aromatherapy. And it's playing a role. It's not solving everything, it's playing a role within our treatment program. Again, we take a holistic picture and we try to improve on it. And aromatherapy is one of those things. Acupuncture is something very different. It is an alternative treatment, which a lot of people say it's a mainstream, depending on where you are in the world. There's meridians, there's trigger points, there's meridians that are triggering multiple areas. So it's too hard to get into, but there's a major difference. Obviously, there's a needle involved. There's different techniques with it. There's techniques where they heat it up and they heat up the area. But the main thing that I can tell you is, like, when you're into a trigger point or you're into one of these meridians, which crosses over in the body, like they say in the ear and the foot, it can have areas anywhere in the body. And it's true. It's been proven that if you can treat certain symptoms, not like major like colon obstruction and things like that, but if you have irritated bowel, there's things you can do for that. I have an acupuncturist that specializes for pregnancies. I'm not exactly sure how that works, but it's a hormone related thing. So there's a lot of uses for acupuncture. Again, very different, but both considered alternative treatments. So that's their similarities, but done very differently. Okay, so next question. I've had 3 injections before in the past and the pain is back. Is there a difference between theirs and yours? Excuse me, that's not corona. I want to say yes, because what I've always used is what I simply term as the double whammy technique. When we go after a problem, I go after what we call the primary pain generator. Again, we're talking about back pain with injections is what I think she's referring to. So if we take the problem, like people throw out the word sciatica. Sciatica is not really the primary diagnosis, it's the secondary diagnosis. The problem usually lies in the root of the back. So when you start talking about the spine, again, this is the spine, this is the front, this is the back, this is the bone, this is the disc, these are the nerves. These nerves are where the problem lies. It lies in the spinal cord and where the nerves branch off. So a lot of times it's at the 0, 4, 5 level, the lower levels. I'm coming into this area and injecting this nerve to block it, because this is what you're feeling down the leg. When I am asking you about leg pain, this is what I'm concerned about. That 90% of the time it's coming from the root. So the root has to be blocked. So what we do is we drop medication under x-ray, under fluoroscopy, right here on the nerve, blocking that nerve, cutting down the inflammation. The second area, so I make sure I'm hitting the nerve that's causing the problem, or what we call the primary pain generator. So when we do that, we know we at least hit that area. We do a second area, which is into the epidural space, which everybody knows about an epidural if you've gone through pregnancy, and that's it. Much different when you have back pain and obstruction. What's going on is I'm putting fluid in here. And we know by the laws of physics that fluid's going to flow to the place of ease. So when we do an injection, we automatically know we're hitting the nerve that's the problem. When you have someone that just does a simple epidural, either in the tailbone or between the 4th and 5th space, which a lot of people do, which they say, oh, it's going there. If you think about it from a logical standpoint, from a scientific standpoint, if I'm putting 10 cc's of fluid in here and it's flowing up and the obstruction is on the right side at the 5th level, majority of that fluid's flowing away from that area because it's not the ease, it's the obstructed area. So that means that whole area can be avoided with an injection that's not done correctly. So you have to make sure that he's identifying what your true problem is and addressing it. Because again, the laws of physics and movement of fluids, the fluid is going to move away from where the problem is. That's where you have to attack that problem, and you attack it multiple times. And when I get back to my silly comment of the double whammy, when I hit here, if the problem's here and I hit from behind it, I'm giving it the 2 to 3 times the chance of the medication getting there. I've seen too many times that the injection is not done correctly, and potentially surgery is being done that didn't have to be done. So, I mean, even at the highest level, I get calls, and I have to bring this up, and I know we're running short on time, that my trainer friend who works with all the rock stars and all the athletes out in California had one of his patients call me. And it's the same thing. We have numerous stories, and I have the same story with one of the prominent rock stars here, that if you get to the wrong person, you're going to get an unnecessary surgery. There's 3 or 4 stories that he tells, there's 3 or 4 stories that I tell of prominent individuals that were heading for surgery and came to us. And that's really what's going on. So what I've always said, and I'll end with, I have one more question, but I'll end with this, is that I'm here to keep you from surgery, because we have all those tools and we can think outside the box and what to do with the alternatives, with the aroma, with the acupuncture, but we're not going to keep you from surgery if that's what you need. So that's our big message at Michigan Sports and Spine, and that's been our philosophy from day one. And my last question says, do you like hockey? I absolutely love hockey. My Troy office sits above an ice skating rink that I've been there 20 plus years. Do I play hockey? I was never good. I ended up going the other direction. And my son is also gone the other direction, but my friends like Draper and McCarty and all that would love to get me on the ice and make fun of me. So we did it. We used to do holiday parties with all the guys back in the day, and their biggest joke was they would take the hockey stick away from me because I wouldn't have anything to balance on. So that was their big joke. So yes, and I got shaved with ice and all that stuff, but I've had some great moments at Joe Louis when Joe Louis went down. That will be well missed, and many memories of being on the ice there. So yes, I like hockey. I love that the questions are coming in. I totally, truly appreciate that you guys have been participating. Tell your friends. Hopefully we're helping. We've had one of our more patients from outside the Michigan, not outside the country yet, but we've had our Canadian friends also calling in. So this has been a great thing, and it's allowing me to reach people that I've never thought I'd be able to reach. So keep the message going, and I truly appreciate it. Peace out. Be good.